Picture this. You're sitting at the dinner table with someone you love. They reach for their glass of water and something looks slightly off. Maybe their hand trembles a little differently than usual. Maybe they smile at you, but only half of their face moves. Maybe they say something that doesn't quite make sense, but you both laugh it off. You assume they're tired. You assume it's nothing. 3 hours later, you're in an emergency room and the doctor is telling you that the window for treatment has already closed. That moment, that 3 hour gap between the first sign and the hospital, is where lives change forever. And the devastating part is that in the majority of stroke cases, especially among people over 60, the warning signs were already there. They were showing up quietly, subtly, in ways that most people don't recognize as dangerous. Because no one ever told them what to look for. I want to change that today, because what I'm going to share with you isn't just medical information. It's the kind of knowledge that could genuinely save a life, maybe someone in your family, maybe even your own. My name is Dr. William Lee. I'm a physician, scientist, and author, and my work focuses on how the body can protect and heal itself when we understand it deeply enough. I've spent decades studying the biology of disease, and I can tell you with full confidence that stroke is one of the most time-sensitive medical events that exists. The decisions made in the first hour, even the first 15 minutes, can mean the difference between full recovery and permanent disability. If you're watching this on the BioSecrets channel for the first time, I want you to consider subscribing right now. We share science-backed health information that your doctor may never have time to explain in a 10-minute appointment. This is the kind of content that can genuinely change how you understand your body in today's topic is one of the most important we've covered. Let's start with something that surprises most people when they hear it. When most people think about strokes, they imagine a sudden, dramatic collapse. Someone falls to the floor, loses consciousness, can't speak at all. And yes, that does happen. But here's what the research consistently shows: many strokes, particularly in older adults, begin with signs that are so subtle and so brief that the person experiencing them often dismisses them entirely, and so does everyone around them. There is actually a medical term for this. A transient ischemic attack, or TIA, is sometimes called a mini stroke. It produces stroke-like symptoms that may last only a few minutes and then disappear completely. The person feels fine again. They think whatever happened has passed. What they don't realize is that a TIA is one of the most powerful warning signals the brain can send. Studies have shown that nearly 1 in 10 people who experience a TIA will have a full stroke within the next 48 hours if they don't receive prompt medical attention. The brain was sending a distress signal, and most people don't know how to read it. This is exactly why understanding the early, subtle signs of stroke, the ones that happen before the dramatic emergency, is so critically important, especially for seniors. Now, before we get into the 5 specific signs, I want to take a moment to explain what is actually happening inside the brain during a stroke, because when you understand the biology, the signs make so much more sense. Your brain is one of the most metabolically demanding organs in your entire body. Even though it accounts for only about 2% of your body weight, it consumes roughly 20% of the oxygen and glucose your body produces. Every second, billions of neurons are firing, communicating, coordinating everything you feel, think, move, and perceive. To sustain all of this, your brain relies on a continuous, uninterrupted flow of blood through an intricate network of arteries and vessels. Now imagine that flow getting interrupted. Either a blood clot blocks an artery. This is called an ischemic stroke, which accounts for about 87% of all strokes, or a blood vessel ruptures and bleeds into the brain tissue, which is a hemorrhagic stroke. In either case, the moment blood flow stops to a region of the brain, the neurons in that area begin to suffer. They don't die instantly, but they begin losing function rapidly. And depending on which area of the brain is affected, that functional loss shows up in very specific and recognizable ways in the body. This is key. The brain controls everything: movement, speech, vision, balance, sensation, thought. So when a region of the brain is being starved of blood, the malfunction shows up as a physical or cognitive symptom somewhere in the body. That symptom is the warning sign. That is the body communicating something is wrong. The challenge is that these early signs can be fleeting, can be mild, and can masquerade as something completely ordinary, especially in older adults, where many of these symptoms can seem like normal aging. Let's talk about the first sign, and this one catches people off guard almost every time. A sudden, unusual headache that feels different from any headache you've had before. Not just a bad headache. The description that neurologists often hear is the worst headache of my life, or a headache that came out of nowhere like a thunderclap. This kind of headache, especially when it appears with no obvious trigger, can signal that a blood vessel in or around the brain has ruptured or is under severe pressure. Now here's where it gets complicated for older adults. Many seniors deal with chronic headaches, migraines, or tension-related head pain. So when a new, unusual headache appears, there is a strong tendency to reach for the pain reliever and lie down. That response is completely understandable but potentially dangerous when the headache is originating not from tension or dehydration, but from a vascular event in the brain. What distinguishes a stroke-related headache? It tends to peak in intensity almost instantly within seconds to a minute rather than building gradually the way tension headaches and migraines typically do. It often comes with no warning, no aura, no trigger. It may be accompanied by a stiff neck, sensitivity to light, nausea, or a sudden change in consciousness, and it may feel located at the back of the head or deep inside the skull in a way that feels unfamiliar. The biology here is important. A subarachnoid hemorrhage bleeding between the brain and the tissues that surround it is one of the most dangerous forms of stroke, and its primary symptom is exactly this kind of explosive, sudden onset headache. The blood that leaks out irritates the surrounding tissues and creates intense neurological pain almost immediately. If you or someone you know experiences a headache like this, sudden, severe, different from anything before, that is an emergency, not a wait and see, an emergency. The second sign is one that people almost universally mistake for something much more innocent. Sudden confusion, difficulty understanding, or trouble finding words. This can show up in a number of ways. A person might stop mid-sentence and be unable to retrieve a word they've used 1,000 times. They might not be able to follow simple instructions. They might say something that doesn't make sense in the context of the conversation, almost like their words and their thoughts have become disconnected, or they might understand what you're saying to them, but have an unusual difficulty forming a coherent response. In seniors, this symptom is incredibly easy to dismiss. We live in a culture where cognitive lapses in older adults are normalized to a degree that can actually be harmful. Oh, they're just having a senior moment. Grandpa gets confused sometimes. That kind of thinking can delay life-saving intervention by hours. What's happening biologically is this: the left hemisphere of the brain, and specifically a region called Broca's area and Wernicke's area, governs language, both the production and comprehension of speech. When blood flow to these regions is compromised, even temporarily, the result is something called aphasia, a sudden disruption in the ability to communicate. It can be mild, where the person struggles to find specific words, or it can be more severe, where speech becomes fragmented or incomprehensible. The critical distinction from ordinary forgetfulness is the suddenness. Normal age-related cognitive changes develop slowly over years. Stroke-related confusion appears within minutes or seconds. The brain goes from functioning normally to struggling rapidly. If you witness this sudden shift in someone you care about, especially if it's accompanied by any other unusual physical symptoms, don't wait. Act immediately. The third sign is perhaps the most visually striking, and yet it's still commonly misunderstood. Sudden weakness, numbness, or paralysis affecting one side of the body. This is one of the hallmark signs of stroke, and yet in its early stages, when the stroke is still developing or when a TIA is occurring, this weakness can be subtle enough to seem like nothing more than a limb that fell asleep. You might notice someone suddenly unable to hold on to an object with one hand, or a leg that feels heavy or uncooperative, or a drooping of one side of the face. Because so many strokes occur in one hemisphere of the brain, and because each hemisphere controls the opposite side of the body, the weakness almost always shows up on one side rather than both sides symmetrically. This is why the classic stroke screening tool, which uses the acronym FAST face, arms, speech, time, focuses specifically on one-sided weakness. When you ask someone to raise both arms, a stroke may cause one arm to drift downward involuntarily. When you ask them to smile, one side of their face may not respond the way the other does. At the biological level, this is happening because the motor cortex, the strip of brain tissue responsible for voluntary movement, is losing blood supply. When neurons in the motor cortex can't function, the muscles they control become weak or unresponsive, and because the neural pathways cross in the brainstem before they reach the spinal cord, damage in the left hemisphere shows up as weakness on the right side of the body, and vice versa. One important nuance here for seniors: numbness or tingling without weakness can also be an early stroke sign. Sometimes the first symptom is not an inability to move, but a strange sensation, a loss of feeling, a pins and needles sensation, or a heaviness on one side of the body. This can occur when the sensory cortex, rather than the motor cortex, is the area affected. It's easy to attribute this to poor circulation or sleeping in an awkward position, which is exactly why this sign gets missed so often. The fourth sign is one that I want to spend extra time on because it's the sign that is most frequently overlooked in older adults, and it may be the one with the most critical implications for acting quickly. Sudden vision changes. Not blurry vision that comes on gradually and clears up with blinking, not the usual difficulty reading fine print that comes with age. I'm talking about a sudden, unexpected change in vision that appears without warning and may affect one eye or both. This can take several forms. A person might suddenly notice that they've lost vision in one eye entirely, described sometimes as a shade or curtain coming down over the eye, or they might experience double vision that appears suddenly and feels disorienting, or they might notice that a portion of their visual field has disappeared. They can see clearly to the left, for example, but when they try to look to the right, everything is dark or absent. The reason this matters so profoundly is the anatomy of the visual system. Your eyes are directly connected to the brain through the optic nerves, and the visual cortex in the back of the brain processes everything you see. But the blood supply to the eye itself comes from branches of the same internal carotid artery that supplies much of the brain. When that artery is partially blocked or when clots begin forming, one of the first places the disruption can show up is in the visual field. A condition called amaurosis fugax, a temporary loss of vision in one eye, is considered a serious stroke warning. It happens when a small clot temporarily blocks blood flow to the retina. The vision loss may last only a few seconds to a few minutes and then resolve completely. That's exactly what makes it so dangerous. The person sees again, feels fine, and assumes nothing serious happened. But what just occurred was a vascular event that may predict a much larger stroke in the hours or days ahead. Vision changes in seniors are often attributed to cataracts, macular degeneration, glaucoma, or simply tired eyes. These are legitimate and common conditions, but none of them cause sudden vision changes that appear within seconds and then disappear within minutes. If that pattern occurs sudden, brief, resolving, it needs to be evaluated urgently, not at the next scheduled ophthalmology appointment. Now I want to pause for a moment and ask you something. If you've learned something important so far, something you didn't know before, I want you to think about who in your life needs to hear this. An older parent, a grandparent, a neighbor, someone in your community. Share this video with them. The information in this script could genuinely save a life, and sharing it costs you nothing. Let's talk about the fifth sign, the one that I believe is the most underestimated of all, because it doesn't look like anything is wrong with the brain at all. Sudden, severe dizziness, or a loss of balance and coordination that appears without an obvious cause. Dizziness in older adults is extraordinarily common, and the vast majority of the time it is not stroke-related. It can come from inner ear conditions, blood pressure medications, dehydration, low blood sugar, and many other causes. This is exactly why stroke-related dizziness gets dismissed so frequently. The person feels dizzy, they sit down, it passes, they assume it was the heat or they stood up too fast. But stroke-related dizziness has a distinct quality that distinguishes it from these other causes. It tends to be severe and sudden rather than gradual. It is often accompanied by a loss of coordination. The person may struggle to walk in a straight line, may stumble or veer to one side, or may feel that the room is spinning in a way that makes it difficult to stand. It may come with nausea and vomiting, and critically, it is often accompanied by one or more of the other signs I've just described: vision changes, facial droop, arm weakness, or speech difficulties. The biology here involves the cerebellum, the structure at the back of the brain that acts as the master coordinator of movement, balance, and spatial orientation. The cerebellum receives its blood supply from arteries in the posterior circulation, a network that is distinct from the main arteries supplying the front of the brain. Strokes in the posterior circulation, called posterior circulation strokes, are actually more difficult to diagnose quickly because the symptoms can be less dramatic and more easily confused with other conditions. A person having a posterior circulation stroke may walk into an emergency room complaining of dizziness and difficulty walking and be told it's probably an inner ear infection or vertigo. Research has shown that posterior circulation strokes are misdiagnosed at higher rates than other stroke types, particularly in the early hours. This makes it even more important that the person experiencing the symptoms or those around them be able to articulate exactly how the dizziness came on, whether it appeared alongside any other symptoms, and whether it feels fundamentally different from any dizziness they've experienced before. Now, knowing the signs is essential, but knowing how to respond is equally important, and this is where I want to make sure you leave this video with a very clear, actionable understanding of what to do. Time is brain. This is a phrase used in neurology, and it is not an exaggeration. Research has established that for every minute a stroke goes untreated, approximately 1.9 million neurons are lost. The neurons in your brain do not regenerate the way cells in other parts of your body do. When they die, they are gone. The functions they once controlled, movement, speech, memory, vision, may be permanently impaired. This is why the treatment window matters so much. The most effective medical treatment for ischemic stroke, the type caused by a blood clot, is a clot-dissolving medication called TPA, or tissue plasminogen activator. It can reverse the effects of a stroke dramatically when given early, but it has to be administered within a narrow time window, typically within 4.5 hours of symptom onset, and ideally much sooner. Beyond that window, the risks of using it may outweigh the benefits. There are also mechanical interventions procedures where physicians can physically remove clots from arteries using tiny devices threaded through blood vessels that can be performed up to 24 hours in some cases. But again, outcomes are dramatically better the sooner treatment begins. Every minute of delay narrows the options and worsens the potential outcome. This is not meant to create fear, it's meant to create urgency at the right moment. So what do you actually do? If you witness any of the 5 signs I've described, a sudden severe headache unlike any before, sudden confusion or difficulty with words, sudden one-sided weakness or numbness, sudden vision changes, or sudden severe dizziness with loss of balance, you call emergency services immediately. You don't drive to the hospital yourself. Unless there is truly no other option. Emergency medical teams can begin assessment and treatment before they even arrive at the hospital. They can coordinate with the stroke team en route. That coordination saves critical minutes. While you wait, note the exact time the symptoms first appeared. This information is crucial for the medical team to determine treatment options. Keep the person calm and still. Do not give them anything to eat or drink. Do not give aspirin unless a medical professional specifically tells you to. Now I want to shift into something equally important, because understanding what causes strokes and what makes the brain and blood vessels vulnerable helps us understand what we can actually do to reduce risk. And there is a great deal we can do. One of the most important risk factors for stroke is something that affects a significant portion of the senior population without obvious symptoms: atrial fibrillation, or a fib. A fib is a condition where the heart beats in an irregular, chaotic rhythm rather than a steady, coordinated one. When this happens, blood can pool inside one of the heart's chambers, specifically the left atrial appendage, and form clots. Those clots can then travel to the brain and cause a stroke. Fibrillation strokes tend to be particularly severe because the clots involved are often larger than those that form within the brain's arteries. The challenge with a fib is that it often has no obvious symptoms. Some people feel palpitations or shortness of breath, but many feel nothing at all. This is why regular monitoring, whether through physician checkups, EKG screening, or even wearable devices that can detect irregular heart rhythms, is increasingly important for older adults. High blood pressure is the single most significant modifiable risk factor for stroke. Over time, elevated pressure in the arteries causes damage to vessel walls, accelerates atherosclerosis, the buildup of plaque inside arteries, and dramatically increases the risk of both clot-related and bleeding-related strokes. The insidious thing about hypertension, as I'm sure many of you know, is that it produces no pain and no obvious warning signs until damage is already done. This is why monitoring blood pressure regularly and managing it proactively through both lifestyle and medical means is one of the most powerful things a senior can do for brain health. What does the science tell us about lifestyle approaches that genuinely support vascular health and lower stroke risk? The evidence for a diet rich in vegetables, fruits, whole grains, legumes, and healthy fats, particularly the pattern associated with Mediterranean-style eating, is robust. This type of eating pattern supports the health of the endothelium, which is the delicate single-cell lining of every blood vessel in your body. The endothelium is not just a passive tube, it's an active biological system that regulates blood flow, prevents clotting, manages inflammation, and keeps the vessel walls flexible and responsive. When the endothelium is healthy, blood flows smoothly and clots are less likely to form. When it's damaged by inflammation, oxidative stress, high blood sugar, or high blood pressure, the conditions for stroke become more favorable. Foods that have been shown to support endothelial health include leafy green vegetables like spinach, arugula, and kale, which are rich in nitrates that the body converts to nitric oxide, a molecule that helps dilate blood vessels and maintain smooth blood flow. Tomatoes contain lycopene, a powerful antioxidant that has been studied for its ability to reduce oxidative damage in the arterial walls. Berries, blueberries, strawberries, raspberries are rich in polyphenols that support circulation and reduce vascular inflammation. Olive oil, particularly extra virgin olive oil, contains oleocanthal and other compounds that exert anti-inflammatory effects directly relevant to arterial health. Omega-3 fatty acids found in fatty fish like salmon, sardines, and mackerel have been studied extensively for their effects on cardiovascular and cerebrovascular health. They help reduce triglycerides, lower blood pressure modestly, reduce platelet aggregation, the tendency of blood cells to clump together and form clots, and support the overall integrity of blood vessel walls. Movement matters enormously. Regular physical activity, even gentle activity like walking, swimming, or cycling, has been shown to lower blood pressure, improve the flexibility of arterial walls, support heart rhythm regulation, and reduce inflammation throughout the body. You don't need to be running marathons. Consistent, moderate movement across the week has a meaningful biological impact on stroke risk. Sleep is another area where the science is increasingly clear. Poor sleep, whether from insufficient hours, disrupted patterns, or untreated sleep apnea, is associated with elevated blood pressure, increased inflammation, and a higher risk of cardiovascular and cerebrovascular events. Obstructive sleep apnea in particular, which causes repeated drops in blood oxygen levels throughout the night, is significantly associated with stroke risk. If you or someone you know snores heavily, stops breathing during sleep, or wakes repeatedly feeling unrested, this is worth discussing with a physician. Managing blood sugar is equally important. Diabetes and prediabetes, which affect a very large portion of the senior population, are associated with accelerated damage to blood vessels throughout the body, including those that supply the brain. Consistently elevated blood glucose damages the endothelium, promotes inflammation, and contributes to the formation of arterial plaques. Dietary strategies that reduce blood sugar spikes, reducing refined carbohydrates and added sugars, eating fiber-rich foods, timing meals thoughtfully, all contribute to vascular protection over time. I also want to mention something that doesn't get enough attention in mainstream conversations about stroke prevention, and that's the importance of social connection and stress management. Chronic psychological stress activates the body's stress response systems in ways that directly affect the cardiovascular system, elevating blood pressure, promoting inflammation, disrupting heart rhythm, and contributing to behaviors like poor sleep and poor eating that compound the risk further. Strong social connections, purposeful daily activity, time in nature, mindfulness practices, these aren't soft wellness suggestions. There is genuine biological evidence for their protective effects on the vascular system. Now I want to come back to where we started, because I think it's important to leave you with the right emotional frame. The 5 signs we talked about: the sudden severe headache, the unexpected confusion or word-finding difficulty, the one-sided weakness or numbness, the sudden vision change, the severe dizziness with loss of balance. These are not things to be afraid of in the sense of living in anxiety. They are things to be aware of. Awareness is not the same as anxiety. Awareness gives you agency. When you know what to look for, you can act quickly, and acting quickly makes all the difference. The brain is a remarkable organ. Under the right conditions, with the right support, it can adapt and even recover in ways that we are still discovering. The medical and scientific understanding of stroke treatment has advanced enormously in recent decades. Survival rates are better, recovery outcomes are improving, and more people than ever before are returning to full or near full function after a stroke because they or someone near them recognized the signs early and acted without delay. That is the power of knowledge. That is why conversations like this one matter. I want to ask you something before you go. In the comments below, tell me, did any of these signs surprise you? Was there one you didn't know about before today? I read through the comments, and your responses genuinely shape what we cover next. The conversation in the comment section of this channel is one of the most valuable parts of what we build together here. And if this video gave you something important, something you didn't know before, please share it. Send it to your parents, your grandparents, your older neighbors, anyone you care about who deserves to have this information. You genuinely might be saving a life by pressing that share button. If you're not yet subscribed to BioSecrets, now is a great moment to do that. We are committed to bringing you science-backed health content that respects your intelligence and genuinely helps you take care of the body you live in. Every week, we dig into the biology that matters, the kind of information that empowers you to make better decisions for yourself and the people you love. Thank you for watching. Take care of your brain. It is the most extraordinary structure in the known universe, and it is working for you every single second. Give it the awareness, the nourishment, and the respect it deserves.